Hi, my name is Jill. I'm coming to you to chat today about nicotine and some of the effects it can have, as well as some resources. Nicotine is found most commonly in cigarettes. There are also other nicotine avenues that nicotine can be used with. I think there are vapes, so tobacco, nicotine vapes. People chew nicotine or tobacco. People work with different like chew and spit methods. So there's a lot of different methods. We're talking about nicotine, and the purpose of this video is talking about all the different aspects of nicotine, as there are effects on the body, the brain, that this video is going to make you aware of. Some of the common ones that maybe we think of when we hear nicotine would be like lung issues, right? So smoker's lungs, as you might hear that phrase or verbiage, talks about the lungs and how when the body takes in nicotine, when we're inhaling that nicotine and that tobacco is going into the lungs, and it really starts to affect the but really that nicotine goes onto the lungs. We can see hardened or calloused lungs. We can see like black. If you were to look at an x-ray under of the lungs, you can see spots. They've actually done biopsies of people who have passed away who were smokers, and they've looked at their lungs and there's kind of black and calloused and things like that. So that's kind of one of the big effects that we think of. There's a lot of other little effects, or not as well known, I guess we could say. So some of those side effects of nicotine usage: dizziness and lightheadedness. So when you inhale nicotine, you may feel dizzy and lightheaded. Sleep disturbances is a really big one. Headaches, nausea, changes in heart rate and heart rhythm. So when we take in that nicotine, increased heart rate, shortness of breath. And then as someone progresses and uses nicotine for a long period of time, we run the risk of things like COPD, emphysema. And I mean, there are many people in the world now who have to be hooked up to oxygen and machines because of their COPD and emphysema that they've got as a result of using nicotine or smoking. Asthma, again, if you're someone who already has asthma, can be really affected or really worsened with nicotine usage. The good news is that if all of this is scaring you, as it should, there's a lot of different resources out there to really help tackle a nicotine addiction or usage problem. There's a lot of different treatments or smoking cessation things. The first thing you can do is go to your primary care doctor, reach out to that resource, and ask for nicotine cessation counseling or a guidance. Some people use a patch. Some people use lozenges to kind of start decreasing the use of nicotine and eventually get to zero. There's also like medication. Some antidepressants also have a dual usage for cravings of nicotine. The American Lung Association, if they have a whole guideline and guidebook on how to stop using nicotine. There's also the SAMHSA, or Substance Abuse and Mental Health website and hotline, that actually has a lot of resources for nicotine usage for adults and also for adolescents who may be affected with wanting to use nicotine. There's also different alternative methods. So there's therapy and counseling. Within that realm, there's also hypnosis that some people have used and found helpful. Psychiatry to help prescribe those anti-craving medications and things like that. All of those things working together in tangent with some behavioral modification and working towards resources and nicotine cessation. So, to summarize what we've talked about in this video, nicotine usage has pretty serious consequences and side effects for prolonged use and even for short-term use. In the short term, after starting to use nicotine, like we talked about, increased heart rate, anxiety, sleep disturbances are kind of some of the big ones. And in the long term, the COPD, the asthma, the emphysema, things like that require permanent treatment or for the rest of your life treatment. But there's also a lot of hope and a lot of resources. So I hope you found this informative. You can go on to the American Lung Association.org or samhsa.gov to kind of start looking into these resources. Thank you so much.